cut in the Senate budget, another eliminating the federal charter for the National Veterans Business Development Corporation, and a number of other amendments are pending. And now to live coverage of the U.S. Senate here on C-SPAN 2.
Amen.
Please join me in reciting the Pledge of Allegiance. Pledge allegiance
to the flag
of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. The clerk will read a communication to the Senate.
Washington, D.C., March 16, 2011. To the Senate, under the provisions of Rule 1, Paragraph 3 of the Standing Rules of the Senate, I hereby appoint the Honorable Kirsten E. Gillibrand, a senator from the state of New York, to perform the duties of the chair. Signed, Daniel K. Inouye, President pro tempore.
Madam President.
The Majority Leader.
Following any leader remarks, the Senate will proceed to create a morning business until 10:30. Senators will be permitted to speak for up to 10 minutes each during that time. The majority will control the first half, Republicans the second half. Following that morning business, the Senate will resume consideration of S-493, Small Business Jobs Bill. Senators should expect 2 roll call votes at about 10:30 this morning. Those votes will be in relation to the following amendments. Nelson of Nebraska regarding a the Senate resolution to reduce the Senate's budget by 5%, and a Snow-Landrieu Coburn amendment striking the federal authorization of the National Veterans Business Development Program. Additional roll call votes in relation to amendments to the Small Business Bill are expected during today's session of the Senate. At 12 noon, Senator Blumenthal of Connecticut will deliver his maiden speech, and he'll speak for up to 20 minutes. We received yesterday a 3-week continuing resolution from the House. I do hope that we will reach an agreement to consider this before the end of the week. I am told, Madam President, that H.J. Res. 48 is at the desk and due for a second reading.
Clerk will read the title of the bill for the second time.
H.J. Res. 48, Joint Resolution making further continuing appropriations for fiscal year 2011 and for other purposes.
Madam President, I would object to any further proceedings with respect to this joint resolution.
Without objection. Objection is having been heard.
Madam
The
President,
joint resolution will be placed on the calendar.
no one can count the number of times this chamber has heard calls for compromise. The call has come from senators of good faith, from every era, from senators both Democrat and Republican. Indeed, it's the very essence of the legislative branch, which was purposely designed to run on consensus, as designed by our founding fathers. As senators, we search for the right arguments and the right incentives that will help us strike that right balance, a balance that will let the Senate and the country move forward. But there's been no stronger argument for bipartisanship than the series of budget votes over the past few days. Last week, the Senate voted on 2 proposals, one written by Republicans and one written by Democrats. Some Republicans voted against the Republican bill. Some Democrats voted against the Democratic bill. And in the end, neither passed. Yesterday, the House voted on another Republican proposal. Again, some Republicans voted against their own party's plan. In fact, a lot of them did, Madam President. And some Democrats voted to the other party's plan. This time it passed, but only because it had bipartisan support. We don't know what will happen when that same question comes before the Senate this week, but we know we won't see a strictly party-line vote. The lesson is obvious. Neither party can pass a bill without the other party, and neither chamber can send that bill to the President without the other chamber. If we're looking for a case study in why cooperation is necessary, that's as clear as it comes. It's just as obvious that we cannot meet in the middle if one side refuses to give any ground. Both parties in both houses must be willing to work together. We cannot negotiate without a partner on the other side of the table, and we will not find a solution in stubbornness. So I'll repeat the request I've made since the beginning of the budget debate. It's a request for reasonableness. It's the same call for compromise and consensus that always kept this diverse nation moving forward. It's the same appeal made by one of the great senators in the history of this country, a senator whose seat the Republican leader now holds. Kentucky's Henry Clay said that, I quote, all legislation is founded upon the principle of mutual concession. Again, the great Senator Clay said, all legislation is founded upon the principle of mutual concession. If the Senate and House cannot pass a long-term budget that keeps the country open for business, another reality will be made very plain to the American people. It will be crystal clear which party was willing to work toward a common goal and which party lacked the courage to compromise. Would the Chair announce morning business, please?
For the previous order, the leadership time is reserved. Under the previous order, the Senate will be in a period of morning business until 10:30 a.m., with senators permitted to speak therein for up to 10 minutes each, with the time equally divided and controlled between the two leaders or their designees, the majority controlling the first half and the Republicans controlling the final half. Senator from Maryland.
Madam President, I take this time to reflect with my colleagues that we celebrate today the one-year anniversary of the passage of the Affordable Care Act, and to reflect on how much has happened to improve health care in America since the passage of the Affordable Care Act. And we have reason to celebrate. If you are a senior in the Medicare program and you now know that you can see your doctor, your primary care doctor, every year for an annual wellness exam, and that wellness exam will now be covered under Medicare, so you have an opportunity to meet with your doctor and take charge of your own health, you have a reason to celebrate the passage of the Affordable Care Act. If you're a senior that happens to fall within the coverage gap under the prescription drug benefits in Medicare, the so-called donut hole, and you've been forced at times to leave prescriptions on the counter at the drugstore because you couldn't afford to pay the cost of the prescriptions, and you now know that there is coverage in Medicare if you fall within that gap. For last year, seniors, 3.2 million of them who fell within the gap received a $250 check. This year, the seniors that fall within this coverage gap will receive a 50% discount on their brand name drugs. Next year, their benefit will be worth as much as $2,400, and by 2020, we will close the gap entirely, all as a result of the passage of the Affordable Care Act. You have reason to celebrate that Congress finally got the job done. And if you are an American family, like many, and you celebrate your child's graduation from college, only to find out that your child could no longer be covered under your health insurance policy because of the age restrictions. And now you learn that Congress has changed that age to 26 so that you can keep your youngster under your family insurance program, and that child now has health insurance, and you're one of 1.2 million people who benefit from this provision that was in the Affordable Care Act. You have reason to celebrate the passage of the Affordable Care Act. Or, Madam President, if you are a small business owner who can now afford to cover your employees because of the small business tax credit that was included in the Affordable Care Act, 4 million eligible institutions will be eligible for that tax credit. And soon you'll be able to get competitive rates. Small businesses today pay 20% more for the same coverage as large companies. But Congress took action last year to eliminate that disparity. If you are one of those small business owners who are now benefiting from that tax credit, or who will benefit from more competitive rates and better choice, you have reason to celebrate the passage of the Affordable Care Act. Or if you happen to be a consumer of health insurance, as almost all of us are, and you want value for your premium dollar, you now know that as a passage of the Affordable Care Act that the lion's share of your health premiums must go for health benefits, reining in the excessive administrative and profit costs of private insurance companies. And you now know that Congress has taken action to prevent the abusive practices of private insurance companies. You have reason to celebrate the passage of the Affordable Care Act. Or if you happen to be the woman in Maryland who was hiking in the mountains of West Virginia and fell off of a cliff and was unconscious and was flown to the closest emergency room to receive care, was denied coverage because she did not call ahead for pre-authorization, you have a reason to celebrate the enactment of the Affordable Care Act. Yes, insurance companies denied coverage for emergency care because of requirements for pre-authorization, or they denied coverage because of the ultimate diagnosis did not meet their standard for reimbursement, even though your symptoms indicated that you should seek emergency care. I started working on that issue in 1995, known as the prudent layperson standards, for requiring insurance companies to reimburse their policyholders for visits to an emergency room where their symptoms indicated that they should go to the emergency room. In 1997, Medicare and Medicaid were changed in order to provide for the prudent layperson standard for reimbursement. Well, now all insurance companies must comply with that standard because of the passage of the Affordable Care Act. Or if you're a parent who has a child who has asthma, or have been told that the insurance company won't provide full coverage because of your child's pre-existing condition, and now you can get full coverage for your child, you too have a reason to celebrate the passage of the Affordable Care Act. And if you're an adult and have been told you cannot get insurance because of pre-existing conditions, such as high blood pressure, or you happen to be like a couple from Montgomery County, Maryland, who had to get 2 separate insurance policies because of pre-existing conditions, paying 2 separate premiums and 2 separate deductibles. And now you know you can get one insurance plan that will cover your family. You have a reason to celebrate because that too was corrected by the Affordable Care Act that was passed by Congress 1 year ago. Or if you happen to be a taxpayer who's concerned about the fiscal soundness of Medicare or the budget deficit, you too have a reason to celebrate the enactment of the Affordable Care Act, because the Affordable Care Act extended the solvency of the Medicare system by 12 years, putting it on a safer basis, making it less vulnerable for our budget. And the enactment of the Affordable Care Act reduced the federal budget deficit by over $100 billion during the first 10 years and over $1.5 trillion during the first 20 years. This is because, quite frankly, Madam President, this bill manages illnesses much more cost effectively. It uses health information technology more effectively. It invests in wellness, and it brings down the costs. That's not what this senator is saying has been established. This is what the Congressional Budget Office has told us will bring in savings on our budget deficit. So taxpayers have a reason to celebrate the enactment of the Affordable Care Act. One other reason to celebrate the year anniversary in the enactment of this legislation. Let me just give you one more example, Madam President. A couple of weeks ago, I was at the Greater Baden Health Center, located about 7 or 8 miles from where we are today. They're doing something about the infant mortality rate in our community. We have too high of an infant mortality rate because of low birth weight babies. Some don't survive and become part of our infant mortality numbers in America, where we are much higher than we should be. Others survive and have complications that need to be addressed by our health care system, making it challenging for the infant and expensive for our society. Well, at the Greater Baden Health Center, they're doing something about that. They're expanding their qualified health center to include prenatal care, so pregnant women can get the type of attention they need to have healthy babies. That money comes from the Affordable Care Act because of the expansion of our qualified health centers. We all celebrate what we're able to accomplish. It will keep our children healthier and save us money, and have less use of the emergency rooms by expanding care at our qualified centers. And Madam President, if you're concerned about health disparities in America, and you have reason to be, minorities are 2 times more likely to suffer from diabetes, 33% more likely to die from heart disease. In the African American community, the infant mortality rate is 2.3 times higher than the white community. When we look at the number of people that have access to health care and health insurance, minority population represents 1/3, yet they are 1/2 of the people that don't have health insurance. I think we all agree that we need to do something about that. That's just not right in our sense of fairness. But let me just give you one more reason. It will save us money. Study done at Johns Hopkins University and the University of Maryland point out that we can save $260 billion in excess direct medical care costs if we can deal with the minority health disparities. Now, we have done something about that in the Affordable Care Act. An amendment that I was proud to introduce established the Institute for Minority Health and Health Disparities within the National Institute of Health. And we have developed minority health and disparity offices in each of our agencies that deal with health care to do something about health disparities in America. We can all celebrate that we're able to move that forward in the Affordable Care Act. Madam President, we should all take pride that America, at long last, after decades of unsuccessful attempts, has acted. And health care today health care is a right, not a privilege. No longer, as our dear friend, the late Senator Kennedy said, we no longer have a sick care system. We have taken action to include all under health care in America. Now, I understand that the Republicans in the House want to repeal each and every one of these improvements and accomplishments. And they offer no hope of taking these issues up in a serious manner during this Congress. Speaking on behalf of our seniors, speaking on behalf of our small business owners, speaking on behalf of the consumers of health insurance in America, speaking on behalf of what is right as far as covering and making sure everyone has access to affordable care, we don't want to see that happen. We don't want to move backwards. We have reason to celebrate the accomplishments of moving forward with health care. We want to move forward, not back, and continue to build upon an American health care system that provides affordable, quality care to all Americans. And with that, Madam President, I would yield the floor and suggest the absence of a quorum.
Clerk will call the roll.
Mr. Akaka.
Madam President,
Republican leader.
I ask consent that further proceedings on the quorum call be dispensed with.
Without objection.
Madam President, the rising cost of gasoline has become a major source of concern for most Americans. And with prices in most states moving closer and closer to $4 a gallon and already higher in some areas, Americans have a right to know where the President and the Democrats in Congress stand on the issue. So let me just begin this morning with a simple observation that it's no accident that gas prices are skyrocketing at a time when Democrats control two-thirds of official Washington. It's no secret that Democratic leaders in Washington don't particularly care for this issue. Ask them about gas prices, and chances are they'll tell you about some car they plan to build and have ready for production about 25 years down the road. Suggest that we tap some of our own domestic sources of oil, and they'll give you 101 reasons why we can't, and how that's not a real solution anyway because it'll take too long to get it out of the ground. We've been having that particular argument for decades now, literally for decades. And then they have the audacity to step in front of the cameras and tell us they're all for reducing our dependence on foreign sources of oil. With what? Windmills? It's time to be serious about a serious problem. The fact is, there's no reason in the world we can't invest in future technologies at the same time that we're tapping into the resources we already have right here at home and creating jobs while we do it. But Democrats don't seem to like that idea. They'd rather force a change in behavior now than give struggling American families the relief they need from the rising gas prices. Don't listen to what they say on the issue. Watch what they do. Well, here's what they've done. Over the past 2 years, the Obama administration has delayed, revoked, suspended, or canceled an enormous range of development opportunities. 1 month after the President took office, his administration canceled 77 oil and gas leases in Utah. Once the review was complete, the administration refused to reinstate even a single one. A month after that, the administration shortened lease terms for offshore oil and gas production and raised fees for permit applications. Last January, it announced new restrictions for onshore oil and gas exploration in the Mountain West. Last February, it denied a permit to build a bridge needed to access an oil-producing field in Alaska after the Environmental Protection Agency designated a nearby river an aquatic resource of national importance. Last April, the administration suspended 61 oil and gas leases in Montana that were issued in 2008. Then announced that all oil and gas leases in Montana, North Dakota, and South Dakota would be delayed indefinitely. Last May, the President announced a 6-month moratorium on deepwater drilling, a moratorium that's been repeatedly struck down in the courts. The list of actions like these goes on and on and on. And that's to say nothing of the proposed new Environmental Protection Agency regulations on energy that would either cause oil refineries to pass along their resulting new production costs to consumers at the pump or drive them and their jobs overseas. So let there be no doubt the White House efforts are costing jobs and putting even more pressure on gas prices. And paying lip service to the public's concerns won't solve the problem. By unlocking our own sources of energy here at home, that would help immensely. Just to give you an idea of the kind of resources we have right here at home, consider that just one 2,000-acre section of the non-wilderness sections of the Arctic National Wildlife Refuge, along with the Truckee and Beaufort Seas, have enough recoverable oil to replace crude imports from the Persian Gulf for nearly 65 years. 65 years. So the problem isn't that we need to look elsewhere for energy. The problem is that Democrats in Washington won't let us use it. The problem is that even with gas prices on the rise, they want to tax it even more. So let's make this really simple, Madam President. I'm going to propose just 2 concrete, practical things we can do in Washington to give the American people some relief. create jobs, and help make us less dependent on foreign sources of oil. Two ideas that would have wide bipartisan support. Let's increase American energy production. And let's block any new regulations that will drive up the production costs for energy. Two ideas that will create jobs and alleviate the increasing pressure on gas prices. Let's leave the ideology aside and do some practical good for Americans who are struggling out there. Let's increase American production of energy with American jobs and stop the job-stifling regulations. I suggest the absence of a quorum.
Call the roll.
Mr. Akaka.
Madam President,
Senator from Illinois.
I ask consent the quorum call be suspended.
Without objection.
Madam President, we're all facing the challenge of gasoline prices, adding a new burden to family budgeting as well as small businesses and large businesses alike. Couldn't come at a worse time in light of our recession and unemployment. But it is important for us to put in perspective where we are today and how we should resolve this issue. When you look at the entire known reserves of oil and gas in the world, the United States has 3%. 3%. And each year, the United States consumes 25% of the energy that is used in the world. So when I hear my colleagues on the other side come to the floor and say, we can drill our way out of this, I say to them, that is unrealistic and doesn't reflect the reality of what we face today. Yes, we should have responsible drilling for oil and gas. We should be sensitive to the environment to avoid the kind of hazards and accidents we saw in the Gulf of Mexico, to protect that part of America and a part of the world that we believe should be preserved for future generations. But the notion that if we could just start drilling more, our problems would go away is not only naive, it is wrong, just flat out wrong. We heard the chants of drill, baby, drill a year and a half ago in the course of a presidential campaign. It's not the answer to America's energy policy ever. We still import $1 billion worth of oil a day into the United States. And it's an indication of our dependence on foreign oil and that any interruption in the Middle East or from other sources is going to raise our prices. And what should we do about it? Several things. First, on the immediate agenda, we should look at the Strategic Petroleum Reserve. The President has to decide, and he said Friday he was considering, releasing oil that we have saved up in this reserve to bring down prices and keep the economy moving forward. I support that. I hope the President will do that. Secondly, we have to look at ways that the current oil pricing is really being gamed by some financiers and speculators. From my point of view, this is something that needs to be not only examined but stopped. This speculation in oil prices runs prices up way too high, way too fast. Third, take a look at the oil companies themselves. The top 5 oil companies are extremely profitable. And in the midst of crises, they make even more money. That's the reality. And then step back and look at our national energy policy. How do we encourage the use of more efficient cars and trucks. Well, we don't do it by entertaining the amendment by the Republican leader in the Senate. He says that the Environmental Protection Agency should step back from even encouraging the kind of fuel efficiency in cars and trucks which reduce our dependence on foreign oil and reduce pollution in the atmosphere. That is a step backwards in the past. It is rejection of basic science. So when the Republican leader comes to the floor and gives his prescription for today's energy challenge in America, I would say to him, the patient's not going to get well, Senator, with your prescription. We have to have a coordinated energy policy moving toward fuel efficiency, reducing the use of energy and still fueling our economy, renewable and sustainable sources of energy that don't pollute the atmosphere. The senator from Kentucky, who is giving us a speech this morning about energy, actually has an amendment that he's preparing for the floor here, which removes the right of the Environmental Protection Agency to even deal with greenhouse gas emissions as they affect climate change and the world we live in. It is stick your head in the sand approach to an issue which future generations will look back on and say, what were they thinking? That they would ignore the reality of climate change in the world and the reality of what pollution is doing to our lungs, our health, our future. It's a reality that's being rejected by the Republican side of the aisle. I might also say, Madam President, ask how much time is remaining in morning business.
4 minutes on the majority side and 22 on.
Thank you very much. Madam President, this is one-year anniversary from the President signing the health care reform, and I am happy to stand here today and say that it represents one of the most important pieces of legislation in decades. For too long, we let our nation's health care crisis grow and ignored it. People who said, let the market work its will, have to be honest about what the market did. The market started excluding people who had pre-existing conditions, and who among us doesn't. The market started charging higher and higher prices for health insurance, and the market, unfortunately, was uncontrollable. We tried to deal with it, to bring pricing under control and deal with the realities that families face across America. When I was in the most heated debate about the health care bill with Tea Party devotees in front of my office in Springfield, I told them, let me tell you about some of the people in Illinois that I've met. And at some point, finally, the Tea Party people said, stop telling stories, Durbin. We don't want to hear any more stories. Of course they don't, because those stories are the reason that we did this. Those stories represent real lives. And let me tell you one of those stories here, representing a family that comes from East Peoria, Illinois. This is Jim, Jill, and Rick Lathrop. They have two sons, Sam and Nat. One of them in a Superman T-shirt. They're 12 and 14-year-old, and they have severe hemophilia. It's a rare and very costly medical condition. Thanks to twice-weekly injections of blood clotting replacement factor that they receive, the boys are able to live happy and healthy lives. They look pretty darn good in that picture. But that life-saving medicine costs $250,000 per child per year. For years, the families lived in fear that they would reach the lifetime limit of their insurance plan. That was a reality. Many of these plans had a ceiling that paid no more beyond a certain amount. It happened to him in 2005. The hospital where Rick works as an MRI technician instituted a $2 million lifetime cap on benefits. For most families, that wouldn't even be an issue. But for the Lathrops, who know that their annual medical expenses will always total hundreds of thousands of dollars to keep their boys alive, this was devastating. Rather than wait for their benefits to run out, the Lathrops moved to Peoria, where Rick found a job that provided insurance without lifetime limits. He changed jobs and moved his family to find an insurance policy that would keep his boys alive. For many years, Rick and Jill held their breath when the annual open enrollment period for their health insurance plan rolled around. They waited on edge to see if their insurance would once again institute an annual or lifetime limit on care that would force them to move again to assure adequate coverage for their sons. Now, thanks to the bill we passed last year, insurance companies can no longer place lifetime limits on your care. Think about what that means to this family that picked up and moved and looked for a new job, looking for new health insurance to keep their boys alive. Is that what America should be? I think not. Now, let me be very blunt about this. As good as this law was, it was not perfect. There are things that need to be addressed, examined, and changed. I've said before and say again, the only perfect law was written on stone tablets carried down a mountain by Senator Moses. Everybody else has been trying and hasn't quite hit that standard. So let's be humble about this and open to change, but let's not repeal this, as the Republicans have called for time and again. Let's not say to the Lathrop family, sorry, you're on your own. And if another lifetime limit comes along, it may literally endanger the lives of these two beautiful little blue-eyed boys. That's what this debate's about. It's a story about a real family. And that's why the other side hates to hear these stories, because the stories literally explain why stepping backwards in time and repealing health care is exactly the wrong thing for America. Madam President, I yield the floor and suggest the absence of quorum.
Clerk will call the roll.
Mr. Akaka.
President.
Senator from Wyoming.
Madam President, I ask that the quorum call be dismissed.
Without objection.
Thank you, Madam President. Madam President, we are just about a year to the day from the day that the President signed into law the health care law that is going to have an impact on all of the people of this country. Here we are a year later, and we know a lot more about this law. People all around the country know a lot more about this law. And I spent part of the weekend visiting the folks in Buffalo, Wyoming, and attending the Buffalo Health Fair. Now, a health fair is a place where people in the community get together. They get their blood tested ahead of time, very inexpensive. It's based on prevention, early detection, things that this health care law was supposed to address, but again, this health care law has failed miserably. And at the health fair, I talked to people who were getting their blood results back, checking their cholesterol, checking their blood sugars to see if they had diabetes, checking their thyroid levels. And as these people were getting their blood tested, and many, many people, probably half of the population of Buffalo, turned out to have their blood tested, they started asking me questions about the health care law and the kind of questions that any American would be concerned about. Am I going to lose my freedoms? Am I going to still be able to keep my doctor? Will it truly get the cost of my care down? And regrettably, Madam President, this health care law, now a year since it's been signed, turns out it's going to be actually bad for patients, bad for providers, the nurses and the doctors who take care of those patients, and bad for payers, the taxpayers, the people that are going to be left footing the bill. Because we know a lot more now, a year after the law has been passed, than we did when it was passed. People remember this as the law that was crammed through the Senate in the dead of night, written behind closed doors, all of the unseemly bargains that were cut to convince senators to vote for it, getting by on the barest number of votes. things like the Cornhusker kickback, the Louisiana Purchase, the sort of things that offended people all across this country. So people are upset with this health care law, one, in the way that it was passed, in spite of the fact that the President promised it would be seen on C-SPAN. All the discussions were held behind closed doors, and despite the fact that many Americans never had a chance to read this 2,700-page law. And Madam President, when the President made his initial speech about what he was aiming to accomplish in health care, I said that'd be great. I mean, I'm an orthopedic surgeon, practiced medicine for 25 years. I think we need to do the sorts of things that the President initially addressed. Unfortunately, the health care law went in the opposite direction. When people worked their way through the 2,700-page bill, they found that instead of lowering the cost of care, the cost of their care was going to go up. Instead of allowing people to keep the doctor that they wanted, they were going to have to, unfortunately, change in that situation. And that's why I've been coming to the floor week after week with a doctor's second opinion about this health care law. So here we are a year later. We know that the cost of health care is going up. The President said that health care premiums would lower for families by $2,500. No family has seen that, Madam President, none that I know, none that I've talked to in Wyoming, not one. Instead, people have seen the cost of their health insurance going up, not down. The President said, well, he's never going to raise taxes, and then, in fact, there are a lot of tax increases as part of this health care law. Even the 1099 form that Senator Johanns has championed on the part of small businesses around the country, the effort to remove these onerous obligations on our small businesses, have nothing to do with health care. Well, boy, that got crammed into this bill in the dead of night so that those who support the bill can claim that it was going to lower the cost. And even the Congressional Budget Office admits that the costs are going up, not down. This is absolutely impacting jobs. The President promised that there'd be efforts for small businesses to have some advantages and some tax credits and some help. What we found out is if you have a small business with 10 employees and it goes to 11, you're going to lose some of those benefits. If you're paying your employees an average of $25,000 a year and you want to give them a raise, you start losing some of the benefits. So in spite of the fact that the President had 4 million postcards sent out to small business owners, very few of them have been able to take advantage of what was promised to them. And now here we are where additional waivers are being given. We're at a point where over 2.5 million Americans have been given waivers from participating in the health care law. And interestingly enough, these are the very people, for the most part, significant number, who lobbied for the bill. Once they found out what was in it, they said, no, I don't want this to apply to me. And now we see that the state of Maine, the entire state of Maine, has been given a waiver. Well, Madam President, I come to the floor today a year after this is passed into law, and I say everybody in the country ought to be able to give a waiver and opt out of this health care law. Opt out completely. These are decisions that should be made at the state level, at the local level. Washington's one-size-fits-all has hardly ever worked for anything, and it sure doesn't work for health care. So in Wyoming, at the Wyoming Health Fair in Buffalo, as I visited with people, talked to them, you know what they're worried about? They're worried about losing their freedoms, losing their choice, losing their doctor, losing the health care plan that they like. In spite of the President's promises, we know that about 80% of people who get their health insurance through small businesses are not going to be able to keep the health care that they like. Why? Because of government mandates. The government has said, no, we know what's best for you. You don't, we do. The government says, we know what's best for your family. The government doesn't know what's best. These ought to be local decisions. And that's why Senator Lindsey Graham and I and a number of co-sponsors have introduced legislation to allow states to opt out of this health care law, opt out of the individual mandate, the requirement that forces Americans to buy government-approved insurance. Let states make that decision if people in their own state need to live under those laws. Let states decide if individuals, if people who are the employers, the people that are the job creators in our communities, if they have to supply government-approved insurance to the people that live there. Let people make decisions at the local level. And then you can lift any newspaper and take a look at what the Medicaid mandates are doing to our states and doing to the budgets of the states. States like Wyoming, where we balance our budget every year, live within our means, are being crushed by these Medicaid mandates. But it's not just small states like Wyoming in terms of population. California, New York, states all across the country are saying to this body, let us out, let us opt out. We can't live under these mandates. But the President's solution is to cram more people onto Medicaid, a program that doesn't work, where many doctors won't see these patients, where the reimbursements are so low, hospitals say, we can't afford to see these patients because of the impact it will have. You know, even the actuaries, the people that look at this, the fair and appropriate way to look at the numbers say 15% of the hospitals in this country 10 years from now may not be able to be open because of the way that this health care law is going. That's not going to provide more access. It's providing less access. And why have seniors rejected this so overwhelmingly? Well, seniors have looked at this and they see $500 billion in Medicare cuts and things like Medicare Advantage. And there's an advantage to being in that program. That's why 1 out of 4 seniors have set up that program and have chosen that program. It's because they want choice. And this health care law is one that is taking choice out of the hands of the American families, taking the freedoms out of the American families' hands. And it is something that I continue to hear from the people in Wyoming and the people across the country. We need to repeal and we need to replace with common sense solutions of allowing people to buy insurance across state lines. Make that legal to do that. To allow small businesses to pool their resources together, to give incentives for individuals who go to something like the Wyoming Health Fair and work on prevention and early detection of problems. Give those people the opportunity to make individual choices. Expand health savings accounts. Those are sorts of things that we can deal with in a responsible way to help American families get the care that they want from the doctor that they need at a price they can afford. That's all the American people are asking for. The care they need from the doctor they want at a price they can afford, and they are not getting it under this health care law. It's now been enacted for a full year. The American people know the truth. Thank you, Madam President, and I yield the floor.
Madam President.
Senator from Nebraska.
Madam President, I rise today to also speak about the health care bill. The first anniversary of any new law should be a time of celebration, one would think. The moods surrounding this bill, though, this health care law, is much different. 1 year later, Americans are demanding as loudly as ever that we repeal it. And it's not surprising, considering the almost constant flow of bad news and broken promises and higher costs and skyrocketing health insurance premiums. We didn't need a year of bad news and broken promises to see this was bad policy. It was fraught with problems from the very moment it hit the Senate floor. Many of us came down to the floor and pointed out the inevitable problems with the legislation. We warned how this law was predicated on faulty accounting that would exacerbate our current and future fiscal problems. It's simply irresponsible, it's short-sighted to argue that legislation will reduce the debt when it's filled with so many budget gimmicks. But that's exactly what Congress did when passing this legislation, and now all across this great nation people are paying the price. The administration now admits that the funding elements of this law did not add up. For example, in testimony before the Finance Committee, HHS Secretary Sebelius described the newly created Class Act entitlement as, quote, totally unsustainable, unquote. Furthermore, in recent testimony, Secretary Sebelius was asked whether the Medicare cuts in the law are used to save Medicare or to pay for the health care law. Remarkably, she responded both. Well, even a child knows that you can't spend $1 on a new toy and then use the same dollar to buy a candy bar. It's wonderful accounting, and it's Wonderland accounting, and even the administration's own Medicare actuary seems to agree. He said the Medicare reductions in the law, quote, cannot be simultaneously used to finance other federal outlays such as coverage expansions and to further the trust fund, unquote. You see, double counting this money is absolutely illogical, and the American people saw through the smokescreen long ago. But the fiscal problems with the legislation are only the half of it. As a former governor, I shared my concern that putting 16 million people into a very, very broken Medicaid system was a fatal flaw of the law. Medicaid beneficiaries already have huge problems in finding a doctor. Nationwide, 40% of doctors will not see Medicaid patients. The Medicaid expansion is like giving someone a free bus ticket and then taking the bus away. But instead of addressing this problem, the law complicates the problem by doubling the number of people on the broken system, Medicaid. If you've got an airplane that's already overweight, why would you load it up with more weight? But even if you overlook the access nightmares created by the expansion, well, the bottom line is our broken states cannot afford this legislation. States are struggling to pay their bills, and now we are heaping more obligations on them. As a former governor, it breaks my heart that we are making those problems even greater. That's why cash-strapped states are begging for relief from the crushing Medicaid mandate that is steamrolling their way. One did not have to be a fortune teller to predict a budgetary panic spreading from one state capital to another state capital. And for what benefit? 1 year later, many of the promises that were used to sell this law, used over and over again, well, they've been debunked. For example, remember the president saying, and I'm quoting here, "If you like your plan, you can keep it," unquote. Well, it turns out that's not exactly accurate. Again, the administration's own Medicare actuary concluded that the president's promise is, quote, not true in all cases, unquote. Turns out that the truth seems to be more of an exception. One of the administration's own estimates projects as many as 80% of small businesses being forced to give up their current coverage within 2 years, 80%. Remember the president promising that he would not sign into law any legislation that did not bring down the cost curve? In June 2009, President Obama claimed that any health care legislation he would sign must control costs. He said, and I'm quoting from the president, "If any bill arrives from Congress that is not controlling costs, that's not a bill I can support. It's going to have to control costs," unquote, the president said. One is left to wonder why the president signed this law, since his own actuaries estimated it would increase federal health care spending by $310 billion. And earlier this month, the Medicare actuary provided us again with a moment of sad truth. He testified that President Obama's promise that the health care law would lower costs was, quote, false, more so than true, unquote. That's astonishing, absolutely astonishing. Remember how the president promised that the health care law would bring down the cost of insurance premiums? As a presidential candidate, President Obama promised no fewer than 20 times that he would cut premiums by $2,500 for the average family by the end of his first term. Yet the average employee's health insurance premium has risen by nearly $1,100 per family since he took office. A recent New York Times article highlighted the missed opportunity. Quote, groups of 20 or more workers have been experiencing premium increases of around 20%, insurance agents say, while smaller groups are seeing increases of 40 to 60%, unquote. Finally, the first year of implementing this law provides clear evidence that the administration does not think this health care law is actually good for everyone. The administration has now granted over 1,000 waivers to certain states, employers, unions, insurance companies, allowing them to be exempt from several of the mandates. The plans approved for waivers cover nearly 3 million individuals. Well, if the law is so popular, if it's so beneficial, why are we exempting 3 million people while the other 300 million have to live with higher premiums and more mandates? This and many other questions have yet to be answered by this administration. However, the President's recent budget does outline his game plan to advance the flawed policy. The current strategy is spend more taxpayer dollars to continue to try to convince a skeptical public that the health care law is really good policy, and number two, if they don't agree, use an enforcement hammer to make sure that they follow and ensure compliance. Buried within the President's budget is a request for not better health care, a 315% increase for the Public Affairs Office at the Department of Health and Human Services. One of the primary tasks of the Public Affairs Office is to sell the health care reform. Furthermore, they've requested 1,270 new Internal Revenue Service agents to implement the law and enforce the mandate. While Speaker Pelosi may have been advocating passing the bill so we could learn what was in it, many Americans weren't so naive. They understood exactly what was in it. They understood you can't spend a dollar twice. They understood that if something sounds too good to be true, then it probably is. And they know that when someone shows up from the government offering a carrot, you better look for the stick. Last year, a real opportunity to craft health care policy on a bipartisan basis was squandered. This missed opportunity will continue to haunt us. Unfortunately, I worry that the second year under this oppressive piece of policy isn't going to be a bit better than the first. It's regrettable that we've reached this point, but of course we were warned. So we'll use this occasion, this solemn first anniversary, to redouble our efforts to right the wrong. We will work to wipe this misguided law from the books to protect the rights of Americans to choose their doctor, select their insurance, and trust in their own good judgment. Many are committed to the cause. I believe it will happen. Madam President, thank you. I yield the floor.
Morning business is closed. Under the previous order, the Senate will resume consideration of S-493, which the clerk will report.
Calendar number 17, S-493, a bill to reauthorize and improve the SBIR and STTR programs and for other purposes.
Under the previous order, there are now 2 minutes of debate equally divided prior to a vote in relation to amendment number 182, offered by the Senator from Nebraska, Mr. Nelson.
Madam President?
Senator from Nebraska.
Madam President, I rise to speak on my amendment proposing a sense of the Senate agreement to cut the Senate's budget by at least 5%. When I go home every weekend, people come up to me at the grocery store, hardware store, and elsewhere, and they tell me they're concerned about our national debt and deficit. They want Washington to cut spending and bring down the cloud of debt that hangs over our economic environment. As chairman of the Senate Appropriations Legislative Branch Subcommittee, I've been pursuing a 5% cut in this year's budget for Congress and agencies and offices on Capitol Hill. We cut this budget a year ago, we're cutting it this year, and we'll be back for further cuts next year. My amendment says that as Congress pursues comprehensive debt reduction while conducting major military action at two fronts, all in the midst of a fragile economic recovery, Congress still shouldn't be exempt from the pain. Fiscal restraint starts at home and with our own budget. Thank you, Madam President, and I yield the floor.
Madam President,
Senator from Mississippi.
I rise to agree with my colleague from Nebraska, to support his amendment, and to congratulate him for his newfound enthusiasm for this idea. Actually, on January 10th, the House of Representatives passed a rule to reduce its spending by 5%. This measure was passed on a roll call vote of 410 to 13. Soon thereafter, I was the first senator to call on my colleagues in the Senate to cut their office expenditures by 5%. This small but symbolic step could save the taxpayers over $20 million. On February 4th, some 6 weeks ago, I requested unanimous consent to take up a sense of the Senate resolution I authored, urging all senators to take such action. Unfortunately, at that time and since then, there's been objection from the other side of the aisle to this unanimous consent request. My effort was bipartisan. I was joined by 14 of my colleagues, Republicans and Democrats, and I thank them. We now have an agreement to take up my sense of the Senate resolution by unanimous consent later in the day, so as to expedite and refine enactment of the provisions of the Nelson Amendment. Based on that understanding, I commend the senator from Nebraska for coming to this idea somewhat late, but support his amendment nonetheless, and thank the chair.
Senator from